several teeth. Values, remember, will be between 60 to 70. We need to extract those two centrals and the lateral incisor. And this is the case. In the same way, you see I do every time the same thing. In the same way, same simple case. Reflex the flap, use the piezo surgery, again, to be able to definitely gently extract the teeth. You have the cyst in the front, you see, and we are going to drill on the palatal side. Rinse, betadine, peroxide, and drill perfectly well. Everything, no magic there. Place those implants, GTO again. Okay, remove the instrument, place the implant. 1, 2, 3, more GTO. Again, to be able to reconstruct and recorrect the ridge. You see, it's amazing because now, by using this biomaterial, I play with soft tissue. Hard tissue will help me to play with soft tissue. Look at the value. 72, over 70, 71, okay. And the last one, we check. What will be this value? Green, 74, 72, 74, no problem. We can take the impression, add some biomaterial at the soft tissue level. Look at that. No membrane with that, never. So I reshape, you see, gingivectomy to the adjacent lateral incisor, matrix suture above the soft tissue between the papilla, above the papilla, close, take the impression. And this is a temporary restoration. Emergence profile, we're on the safe side. The 3 implants are placed. Look at that. We have added all this material here. Look at that. Remember? Very nice. And this is the following day. Beautiful tissue. Time goes, we went from there. Look, you see, you remember the tissue was bluish, thin, inflamed, and suddenly, with immediate loading, after a few days, everything's changed definitely, tremendously. So, question is, would you immediately load with a provisional restoration since edentulous site is in aesthetic zone? In partial edentulism, answer is yes. The value is between 70 and 74. And even if we had 65 for one implant, but now we are on the safe side, I can really do immediate loading and everything will be okay.